Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician's office. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Pigmented skin lesions. The presentation of pigmented skin lesions to the primary care physician is important because of the increasing incidence of malignant melanoma. Although not all pigmented skin lesions are melanoma, the early diagnosis of melanoma is critical. Delays in diagnosis can result in death. So, we will start with discussing melanoma in this video and expand our discussion to treatment in the following video. The thickness of a melanoma determines the prognosis. Detection when they are thin is critically important. An irregular border is characteristic of the lesion. A significant percentage of melanomas develop in already existing moles. These are also called nevi. Initially, in many cases, the lesion spreads laterally. This is the stage when it should be removed. A melanoma typically occurs in the age range of 30 to 50 years, but it can occur at any age. It can occur anywhere on the body. And again, it is usually asymptomatic. It can bleed or itch. The physician will want to know if there have been recent changes to a mole or freckle, change in size or thickness, change in shape, change in color, change in border, bleeding or ulceration. There are different kinds of melanoma. Lentigo maligna is a slow-growing melanoma. It grows on areas exposed to light and is predominantly found in the elderly. It can become invasive if not removed. It typically progresses very slowly and can remain in a non-invasive form for years. Superficial spreading melanomas. Initially, the growth is lateral, but will turn downward and thicken and extend vertically. It represents about 70% of melanomas. It is a form of melanoma in which the malignant cells tend to stay within the tissue of origin, the epidermis. This is referred to as in situ. It may stay there for a prolonged period, again, months to decades. At first, superficial spreading melanomas grow horizontally on the skin, laterally. This is known as the radical growth phase. The lesion presents as a slowly enlarging flat area of discolored skin. An unknown proportion of superficial spreading melanomas become invasive. That is, the melanoma cells cross the basement membrane of the epidermis and malignant cells enter the dermis. A rapidly growing nodular melanoma can arise within superficial spreading melanomas and start to proliferate more deeply within the skin. Nodular melanoma. This makes up about 20% of melanomas. It is typically found on the trunk of the body and limbs. It occurs predominantly in the young to middle ages. Nodular melanoma is an invasive form of melanoma. Melanoma, again, is a potentially serious skin cancer that arises from pigmented cells called melanocytes. In nodular melanoma, malignant melanomas proliferate downwards through the skin. Again, this is known as vertical growth. The lesion presents as a nodule, a lump, that has been rapidly enlarging over the previous weeks to months. It can arise de novo in normal spreading skin or within an existing melanoma or other type. Acral lentiginous melanoma. This is a melanoma that occurs on the palms, soles, and ends of the fingers. Amelanotic melanomas. These are flesh-colored papules that increase in size. They also change their shape. These can be diagnosed late and therefore can result in a poor prognosis. Now, we have to remember that not all pigmented skin lesions are melanomas. Common skin lesions such as a hemangioma, a dermatofibroma, a pigmented seborrheic keratosis, a pigmented basal cell carcinoma, a blue nevus, a dysplastic nevus, or a lentiginous can be mistaken for melanomas. So it is important to have a dermatologist take a look at the lesion, or have a primary care physician who's skilled in skin cancer to look at the lesion. Well, I hope this helps. We'll continue our discussion in the next video. Have a good day.